Welcome to the Learning Module for entering Coordination of Benefits, or COB, into an 837I inpatient claim. This video does not demonstrate the full claim submission process. If you have not submitted a Minutes Direct Data Entry claim before, please refer to the Minutes User Manual and select the appropriate claim for your service. For information on how to enter COB on a professional claim, refer to the video Entering Coordination of Benefits with Third-Party Liability, 837P. Let's learn about Medicare. There are two ways to get Medicare coverage: through Medicare Part A and Part B, or through a Medicare Advantage plan, also referred to as Part C. Medicare Part A covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Some people also have additional coverage through a Medicare supplement insurance, like Medigap. This is considered a third-party liability, or TPL, insurer. If a member receiving services is covered by Medicare or other insurance, you must first bill the other insurance before billing Minnesota healthcare programs. After billing all other insurances, you will receive a remittance advice or an explanation of benefits. Providers will use the information on this statement and enter it into the Minutes COB section of a claim. Here is an example of a remittance advice, or RA, for a Medicare Part A claim. These do not have a standard appearance, so the statement you receive after billing Medicare may look different. When you receive an RA, it is important to determine if it is for Medicare Part A or Medicare Advantage plan, as the information is entered differently in the COB screen. In this video, we will demonstrate how to enter coordination of benefits using two RAs, one for Medicare Part A and the other for a Medicare supplement. We will begin by logging into our Minutes account and selecting the 837I institutional claim from the left window. We will assume that you are familiar with filling out the first two screens of the claim, so we will jump to the COB screen. Medicare Part A is always entered at the claim level, also known as the header level. The information entered at the claim level prorates over the entire claim. Using our sample RA for Medicare Part A, we enter Medicare for other payer name, we enter the primary ID found on the RA, and select MA-Medicare Part A from the drop-down list for the claim filing indicator. If our RA was for a Medicare Advantage plan, we would select 16-Health Maintenance Organization, HMO, Medicare Risk for the claim filing indicator. Note, if we do not select the correct claim filing indicator, our claim will be denied. Once we complete the Other Payer section, the system automatically expands the rest of the fields on the COB screen. If you are unsure how to complete the fields on the COB screen, click on the Help button on the upper right corner. This will open the Minutes Help Text -837I COB table in a separate window. At the top of this page is a link for the Minutes Field Completion Guide for the 837I COB screen. Use these resources when completing your claim. In the Expanded section, we select P Primary from the drop-down list for the appropriate payer responsibility. Next, we will enter the insured ID into the corresponding field. We enter the relationship code by selecting the most appropriate choice from the drop-down menu. In this example, we choose 18-Self. The next section is the Claim Level Adjustments section, where we enter the adjustments from the RA. We look for the line that says Adjustment Reason Codes. It should be towards the center of the RA. We will use the adjustments on this line and enter it into the Claim Level Adjustments field. We enter the adjustments in the same manner we would for any type of direct data entry claim and click the Add button after each entry to ensure the information is recorded in our claim. Once we've added all the claim level adjustments, they are displayed in the Claim Level Adjustments field, and we review them to make sure we have entered them correctly. Next, we will add the other payer amounts. In our example, the total amount billed is $10,985.74. Medicare paid $5,332.20. So we enter 5332.20, identified as the net ream amount in the payer paid amount field. We leave the non-covered charge amount field blank. Then we enter the other payer's claim control number. On RRA, this is the Internal Control Number, or ICN. Next, we enter the adjudication or payment date from Medicare, which is the paid date found at the top of the RA. On our Other Insurance Information section, both the benefits assignment and release information are defaulted to yes. This is correct for our claim, but you should review this section when submitting your COB. Below the Other Insurance Information section are two expanding fields, the Inpatient Adjudication Information, MIA, and Outpatient Adjudication Information, MOA. If there are remark codes on our RA, we would enter them in the MIA or MOA fields. We do not have any remark codes on our RA, so we select Save to save the information that has been entered. If everything that is required has been entered, a message will display at the top of the screen that says Claim Level COB has been saved. If we had no other insurance to enter, we would select Continue to complete the claim. We have a Medicare Supplement RA to enter, so we select the Add button at the bottom center of the screen. This creates a new line, indicated with the number 2 on the COB screen. Using our Medicare Supplement RA, we enter Medica for the other payer name, the other payer primary ID, and select CI Commercial Insurance Company from the drop-down list for the claim filing indicator. Once the other payer information is entered, the system automatically expands the rest of the fields on the COB screen. In the Other Payer Subscriber section, we select Secondary for payer responsibility because Medicare Part A was the primary payer. We enter the insured ID and relationship code. We complete the remaining fields on the COB screen using our Medicare Supplement RA in the same way that we did for the Medicare Part A. Once everything is entered, we select Save. Again, if everything that is required has been entered, a message will display at the top of the screen that says Claim Level COB has been saved. We click the Continue button in the lower right of the COB page to complete the rest of the claim. If you have questions about submitting a claim, refer to the Minutes User Manual or contact the MHCP Provider Call Center at 651-431-2700. The Department of Human Services offers various training opportunities, including other on-demand videos and online sessions. You can register for the online sessions by visiting the MHCP Enrolled Provider Training page on the DHS Provider website. Check the MHCP Provider News and Updates for announcements on changes to programs and information about new learning tutorials when they become available. Thank you.